Hey everyone, this is Dr. Amar from Elite Orthodontics, and today I want to talk about treating problems earlier before they get worse. This is a patient who was about 9 years old when came to my office. Now, the upper right canine is coming down pretty nicely, but the upper left canine, you can tell it's tilted more toward the lateral incisor and pushing on the roots. Even though the patient is not 13 years old or 12 years old, canine is not considered impacted by definition, but you can tell for sure that this tooth is impacted in the future and might cause even more damage to the adjacent teeth. Most of the problem usually comes from crowding. So in this case, this patient needs to be handled by expansion. We need to widen the arch, create more room for the canines, and then we see how this goes before we surgically go in and try to erupt the canine. In this case, patients, for whatever reason, did not elect to do the treatment and they waited a couple years. And I will show you on the next x-ray what happened after a couple years. Here you can see 2 years later, most of the adult teeth are in place. Again, the canine did not make any progress and actually further pushed the lateral roots more toward the central root, and that could cause damages to the teeth. Now we jumped in now and did expansion, trying to open the space. But in this case, because the root of the canine is mostly formed, we ended up having to do surgical exposures where they put a little chain on that tooth and I had to erupt it orthodontically. And here I will show you a great way to erupt canines without getting side effects or canting the occlusal plane. A lot of orthodontists use a simple way with elastic threads or a chain, but in this one I want to show you how to use special springs. Thanks to Dr. Rich Burns, who taught me how to do this when I was in residency back in Ohio. But I will show you how does those springs work and how does that help us to achieve a very quick, guaranteed eruption of the canine. Here you can see the canine is down. I opened more space for it, bring it down, then I will close all the space. You see the canine is actually down and you can see that little glue on it with that chain that I told you about to bring it down. Here we can see the passive version of that spring. It's literally a little helix in the back next to the molar, and that spring goes down. It's like a pin, and then we tighten this actively to the canine to bring it down. This is again another angle with a magnifier to see how that loop looks like before it gets bonded to the canine. Here you can see, again magnified, how it's actively hooked up to the canine. Why do I go that hard way to be able to achieve good results? Is because I do not want any side effects on the occlusal plane or the smile line. We do not want the upper canine to come down but lift up the front teeth in a canted situation where it's very difficult to fix. That's why auxiliary mechanics like those do the best job. Thank you.